Good morning, everyone. I said around 9 o'clock because I don't think we ever start these things on time. But I am with Julia Hochstadt. You guys know her as one of our mommy bloggers. I love her blogs because she always talks about real stuff. How old are your kids again?
6.5 and 4.5.
6.5 and 4.5. So those are really great ages to talk about.
Sometimes they're great.
Sometimes. So Julia is a talk therapist, right? You specialize in talk. I always say you're a talk therapist. You specialize in talk therapy.
Talk therapy, psychotherapy. I'm a clinical social worker, all of the above.
So I just want to, I don't know if you guys noticed this on Facebook, that you can start watch parties. So anytime we go on live or these guys go on live, I actually try to start a watch party. So then we can make everybody else aware that we are on. So I'm going to do that really quick. Turn this down, sorry. All right, there we go. So what are we talking about today? First of all, we are going to have our lunch at BB's tomorrow at 12 noon. So if you go into the event section of the group, you can just click on it and all the details will be there. It's $18 in advance and $20 at the door, and it's a prefix lunch menu, and you get to pick 2 items off the menu, and you get to have a drink, and it's great. And Julia is actually going to be speaking tomorrow. So really quick, tell us, what are you going to be talking about with the audience?
Yeah, so I'm very excited for lunch tomorrow. For those of you who have not been to BB's in Westwood yet, the food is delicious. It's a really beautiful place. People are always asking for recommendations for, where do I do this christening? Where can I do this 60th birthday party? So, you know, if you're looking for a nice way to spend an afternoon, lunch is always great. But I'm going to be talking about a couple of different things. So you'll have me there as a resource. If people want to ask me questions, you can ask them publicly. You can approach me and ask me privately. You could message myself or Renee ahead of time, really across the board if you have general questions. But in honor and recognition of April being National Sexual Assault Awareness Month, I have a presentation planned for tomorrow that's going to cover some of the very basics, like the 101s of sexual abuse and sexual assault. So for those of you who just clicked and ended the video because you don't want to hear any more about that, I respect that position. For those of you who feel a little ambivalent or mixed about attending a workshop like this tomorrow, please know that there's not going to be any pressure for anybody to talk about anything, participate in any way. If you want to come for lunch and you want to tune out the presentation, the talk that I'm going to give, this is a lunch and an opportunity for you. If you want to get some information about resources, about language tips, if you are a survivor, and you want to acknowledge that in a safe, supportive space, if you think you may know a survivor, if you're just interested in the information, if you simply want to get together with a great group of ladies, all of the above reasons, this would be an opportunity for you to come to lunch. I think that one of the most important things that I like to bring to a presentation like this is I like to break down what we're talking about, because this kind of topic can be overwhelming and scary and intimidating, and that makes a lot of sense. But this is not meant to be, nor is it really going to be, a scary, threatening.
Yeah, it's about awareness.
Exactly.
It's about awareness. And just to back up a little bit, can you tell our moms and our audience about where your background in this and why you're so passionate about it?
Sure. So many of you know this already, I think, but I've been working in the anti-violence field for almost 20 years. So I have spent a lot of time in acute healthcare settings, so working in emergency rooms, providing services to people, primary survivors, their family and friends who have just experienced something. So they may be coming to the emergency room for medical care, for evidence to be collected, that kind of thing. But I also have many years of experience providing ongoing therapeutic support and psychotherapy, connecting people to resources, running groups, and I love the work so much. And the number one thing that I love the most about it, frankly, is the resiliency that I think a lot of people think about sexual assault, domestic violence as being all doom and gloom, and it's really not. It's really not. And again, you know, these types of violence thrive in silence. So most importantly, I think, the fact that Renee is so generous with her time and with the group's time, and that we're even putting on a lunch like this tomorrow, really speaks to, no pun intended, promoting awareness, right? And giving people some tools and tips and really space and connection to talk about our experiences so that we're not dealing with these kinds of things on our own.
Well, you had just said about how it thrives in silence,
Mm-hmm.
right? And I think from being a leader in this mom community for now over 4 years, I have heard many, many tales from women who have experienced something, and they don't, it's not necessarily okay, or you don't have the safe space to be able to talk about it. And everybody's been through something, and then they live their lives like, I'm fine, I've dealt with it, it's in the past. But it does affect you as you go through life if you don't have a place to really be able to talk about it, safely talk about it, because there's a lot of different aspects of when any sort of abuse or trauma assault that come with it, that have to do with shame and the way you end up hardwired after you go through something like that. And I just think it's, go ahead.
I don't want to interrupt you. I just want to jump in that, a presentation like the one I'm going to give tomorrow is relevant for people who have never had an experience of sexual violence, right? So if you've not had a family member or a friend disclose something like this to you, this information could still be very relevant for you, because the truth of the matter is, and again, this is not meant to be scary, but the truth of the matter is that any of us at any point could be on the receiving end of a disclosure of sexual abuse or sexual assault, whether that's from a young person, an older person, an elderly person, our children, a colleague, and what I am hoping to do is to give people some tips and tools ahead of time in terms of how to respond most effectively to hearing this kind of information, which you may never expect to hear, right? And I think at the end of the day, people want to be able to say the right thing, do the right thing. I don't want to make things worse. What should I do to help support my friend or my child or my partner? And so, I'm a big believer of, trying to plan ahead as best as possible. And so I want to be able to give this information to people proactively.
Which leads me into the reason why I wanted to bring Julia on in the first place. I don't know if you guys remember, part of our lunch tomorrow is also about our children and how are we raising our children, and the terms we're teaching them, and how to be mindful, and arming them with information and teaching them to be aware of their surroundings at any age, and also being able, if something does happen, them being able to feel comfortable enough to come forward and to speak about it to obviously a trusted source. So this leads me into my next topic. So I posted, I don't know, it was probably a couple weeks ago, I was talking about my children, and we were just talking prior to going on live about how we were going to kind of, broach this topic. And I was thinking about my kids when they were younger, when they were really little. And one of my biggest fears was somebody touching my children getting molested, like something like, well, how do you protect your children from that? And I thought I'd be obsessed with it. Like, it would scare me. I would think about it all the time. I try not to think about it, but it was just this really real fear that I had. And then some of the other mom friends that I had made, they started talking about how that was a huge fear of theirs as well. I remember one specific friend of mine, she said to me, she's like, am I crazy? Because like, I feel like sometimes like I'm sick or something in the head because I think about this all the time, like something that could happen to my daughter, not just your daughter, our sons as well. So I posted about how I've been talking to my children since they were young, since they were at the age of 2. And I was talking to Julia earlier about how every year that conversation changed about what kind of terms to use when it came to body parts, what the kids should be aware of, like who should be able to address them or see them, without their clothes, and all of these things. I have that conversation year after year with them. It's different, it's age appropriate, but we are so scared about talking to our children about this for multiple different reasons. And I wanted to speak to Julia, an expert in this field, because I do believe it is important that we do have these conversations with our kids, but how do we have them?
Right.
What's appropriate?
Yeah.
What's age appropriate? What's not? Are we instilling fear in our kids by teaching them these things? So I wanted to kind of hand it over to Julie at a time to talk about that.
So this is something that comes up a lot of times with parents, with caregivers. I think it can come up with teachers. And I've given talks before about having, like, in general, tough conversations with kids, and that they can, talking with kids about drugs or, friendships or going off at college. I mean, difficult conversations are difficult because they're hard for lots of different reasons. I think talking with kids about abuse or victimization or violence of any kind, it could be scary, maybe in different ways, obviously, on different levels. And the truth of the matter is, I think for a lot of people, is that we don't want to talk about this stuff because we can hardly bear to think about it, let alone talk about it with our kids. And, one thing I think it's important to keep in mind is that talking about something is not the same as that thing happening, right? But I could think of lots of different examples of, people ruminating about something and thinking about something over and over and over again, and then saying the words out loud to a friend, to a therapist, totally different things, right? And sometimes I think a lot of people feel as though talking about something makes it real, right? Makes it possible. And nobody wants to think that it's possible, that anybody is susceptible to assault or victimization, especially our kids. But it's important to keep in mind that talking about something is not necessarily going to make it happen, right? And I'm a big believer in having open dialogues with kids, especially around abuse and victimization, and who's in charge of your body and who gets to say what and do what to your body, just like Renee was saying, in terms of dressing and undressing, bathing, helping you in the bathroom, touching, all of that kind of stuff. But all of that being said, I think happens in a context of you as a parent, right? You in a partnership or not, right? What are you comfortable with? What are you not comfortable with? What words would you want to use? What words would you not be comfortable using? What does your community support? What do your morals support, right? What do you value? What do you and your spouse, your partner, you as an individual, what do you value? What's important to you? Religious beliefs, right? How do they factor in? So while I am a big advocate for having these conversations with kids of any age, I recognize that doesn't necessarily align with how other people parent and what your philosophies are around parenting. And there's no judgment as far as that goes. Right. Like anything else, as parents, we figure out what the hell we're doing as we're doing it sometimes. And you have to do what works for your family and what works in your house. And what works in my house is not necessarily the same as what works in Renee's house. And that doesn't mean that one of us is doing it right and one of us is doing it incorrectly. Another piece of this is, though, that, I recognize that I, as somebody who specializes in these areas, I'm very comfortable talking about sex, talking about body parts, using, anatomically correct language, and also using words that my clients feel more comfortable with if it's different than anatomically correct language. The mechanics of sex are things that I'm talking about all day, every day. And I realize that that's not necessarily everybody else's experience.
Let me stop you, because we have a lot of moms in our group that have young children.
Yeah.
And that's, I always go back to when, because my kids are older now, so I don't relate in the present like with other moms who have the young kids, but I do remember what it was like to raise my kids and to have these questions about talking about being anatomically correct, right, about body parts, because a lot of parents think, well, if I use anatomically correct terms like penis and vagina and whatnot, then I might have to start talking about what they're used for. Like my kids are gonna start asking questions about that. Right. What is your professional, advice about that? Because I do think it's really important to teach them about, because honestly, you guys hear these stories all the time. It's like, who's the most commonly in child sexual abuse, it's usually somebody that they know, right? Most of the time. Right. So as far as using terms that are not like the snake or whatever it is, and not using, and teaching your kids like, okay, this is what this actually is, or what. How do you talk to your kids about that without being totally paranoid that, like, oh my gosh, now they're gonna start asking me questions about what this stuff is used for? Which
well, and that could, what are these parts used for, are questions that could come up anyway, right? And if you are a parent out there who's struggling with, oh my God, I don't know how, having nothing to do with abuse or assault, if you need some support around that, reach out, talk to me, talk to Renee, talk to your friends. There's support for those kinds of conversations also. But I'll give you a real life example, right? So I said I have a 6.5-year-old daughter and I have a 4.5-year-old son. And what those conversations look like in my house right now are about body positivity, right? I am the captain of my ship. You're the captain of yours. That goes for anyone at any age. I may be the mom and I may be in charge of a lot of things, but you are responsible and you are in charge of your body. So my husband and I message that to our kids constantly, right? We're talking to them about setting boundaries, setting healthy boundaries around your body and who's allowed to do what to it, and ultimately who's in charge of deciding. I'm in charge of deciding for my body. You're in charge of deciding for yours. So this morning at about 6:30, my kids were fighting over harmonicas, right? And they were tickling one another. They were fighting. If your house was not also playing 2 harmonicas at 6:30 in the morning, are you really living? So it was terrible. And they were fighting. I forget, somebody was tickling who, they were wrestling, they were doing something with one another. And my daughter, I think, was calling a timeout. She was saying, stop, stop, stop. My son wasn't listening to her. So I heard my daughter shout out, Jake, I'm in charge of my body, and when I say stop, you have to stop. And both my husband and I reacted like that. These conversations my kids are having between the two of them all the time. This was the most recent exactly. This was the most recent example that happened real life, true story, this morning. But we reinforce that message over and over again. If somebody's tickling, if somebody's stealing somebody's harmonica, if somebody's doing something to another person's person, and one of the kids is uncomfortable, or if my kids are clinging on me, you can probably all relate to, as a mom, people are dragging on your legs, hugging you tight, doing this, doing that, pulling on your hair. Sometimes I just need enough. And so when I say to my kids, it's my body, I'm in charge, I need some space, they know that that's it. I don't have to say no explicitly, right? I don't necessarily have to struggle and shove them off me, but we've established with them that body boundaries are a real thing and that they are to be respected by another person. So if my son really wants to give me a hug, but I'm in charge of my body and I've said I need a body timeout or something to that effect, he knows that I have the final say over my body.
This is great. I mean, this is something that I never really thought about. Like, you don't necessarily, I mean, teaching about body parts is good, but this is actually,
it's part of the conversation.
More sense about boundaries and knowing your feelings and what's comfortable and uncomfortable and appropriate and not appropriate, and being able to vocalize it in a constructive manner, which is great.
And the conversation, it's not a one and done, right? And we're not only talking about using words like penis and vagina, right? Though there might be a time and a place that we are having that conversation. It's not only about stranger danger. It's not only about who can wash you in the bathtub, who can help you in the bathroom. There are lots of different ways to instill these kinds of messages in our children and frankly to other adults, that I'm in charge of my body, or when I say no, I mean it. It doesn't have to be said in a particular way. So I think that a lot of times people will boil these kinds of conversations down to some very particular, oftentimes scary things. And then how am I supposed to talk about that with a little one? You know, a 4-year-old's not going to get what I'm talking about. Right. Well, they can, depending on what you're saying and how you're saying it and in what context you're doing that. It can be tough for the little ones. It can be really tough for us as the parents, right? It can be very scary. We can feel really unnerved by it. But, you know,
I feel like you're stealing their innocence to a certain extent, or you feel like you're going to traumatize them. Like every time I have these conversations with my kids, that's what I'm always thinking. I'm like, oh my God, are they going to go out into the world and go hang out with their friends and go to sleepovers and be paranoid the whole entire time? They're not, thank goodness. But you wonder these things, like, how am I affecting my child by speaking to them about these serious topics.
But I will say that I don't want to give too much away because I do want a lot of you guys to come to the lunch tomorrow, and I hope you will. But that there's a ton of research and data out there that suggests that, and really supports that, following a disclosure or setting the stage for even allowing a disclosure to take place, and disclosures are really hard for lots of people, no matter what the age, disclosures of something happened to me. The number one supportive factor is a maternal response to a disclosure. And if, you know, a step before how a mother may respond, it's, can I even talk about this with my mom? And at the very least, having these kinds of conversations sets the stage with our kids, with our friends, with our, you know, our community, with our colleagues, whatever. I'm a safe person to have this conversation with, right? So if I let my kids know that, you know, if I let them know by allowing and opening up opportunities for us to have these kinds of conversations, whether they're explicit or not explicit, right? I'm also hoping that, God forbid, in the event that my child does need to talk to me about anything like this, that they know I'm an okay person to do that with. And then, as I said, research suggests that the number one protective factor following a disclosure of childhood sexual abuse is maternal response. Does my mom believe me? Does my mom talk to me about this? Can my mom look me in the eye when we're talking about this, right? Is my mom able to connect me to resources? And specifically, the literature suggests maternal response is different than paternal response, which doesn't mean that paternal response means nothing, right? But it means that having a mom who is able to respond effectively to a disclosure, and that doesn't necessarily
to a boy
mean,
or a girl.
Of course, to a
right,
boy or a girl.
Right.
Responding effectively could mean, I don't know the first thing when it comes to whatever this is, but I remember somewhere that I heard someone speak on some Facebook Live video, I'm going to try and connect to that person as a resource. That could be an effective maternal response. You do not have to have all the answers, all of the information, and certainly watching this video, attending a luncheon like tomorrow is not going to make everybody walk out feeling experty. That's not the point, right? But it's to open up and begin a dialogue, begin a conversation about this kind of stuff. So can I mention something about awareness since I'm sitting here in my...
Before you do, I was going to end with that actually. So I don't want to forget. Get to that in like 2 minutes. But before, she's talking about this open dialogue, and you're talking about maternal response, which I think is really important because, as I said, you know, I've thought over the last decade of being, you know, being a mom about like, is this appropriate? Am I traumatizing my kids? Am I stealing their innocence? And I know that I have not. So I know that I've in our house, because I don't judge what other people do in their homes, that I've done a good job in that respect. But about the maternal response, just to tell a little funny story here. My daughter took a mental health day, as you guys saw. I posted on Monday. We had some family stuff going on, and my daughter asked me if she could take a mental health day. So we did, and we drove down to the beach because she wanted to pick some shells. That was her mental health therapy. And we're in the car, and she's just sitting there. She's on her phone, you know, with her Instagram, whatever. And then all of a sudden, as I'm sitting there driving, she looks up. She's, "Mom, just got a question for you." I said, "Okay." She says, "So, you know, men and women when they do that thing," and I was like, "Sex?" And she's like, "Yeah." And she's like, "And you know those like balloon things that you use for protection?" Because my daughter's 12, she's almost a teenager. We've talked about condoms in our house, and she's like, "Oh, that thing that like the balloon thing you blow up." I said, "Yes." I'm like, "A condom?" She's like, "Yeah, one of those." She's like, "I was just confused. Like they make specific things for that." She's like, "Why can't you just use a plastic bag?"
For a 12-year-old.
I just had to tell that because it's funny because she's literally, you know, you're staring up into space, and you know when you just think of stuff like just random silly stuff. But my 12-year-old just out of the blue, I don't know. I don't even, honestly, I was starting laughing my ass off. And I don't know, I said something about how, like, well, they make, oh, no, this is what I said. I was like, yeah, I'm like, I don't know if you want to have a plastic, because she understands what sex is. I don't know if you want to have a plastic bag in your vagina. Or maybe you want that shoved up there or something. And that was like 2 more minutes of the conversation of me laughing. But my kids know, I mean, the whole point of me telling this story is so they feel comfortable being able to ask me these questions, because I would much rather my daughter come and ask me about condoms and why you can't, why you shouldn't use plastic bags and a rubber band versus going and asking their friends or their
we're not asking at all.
Asking at all.
Okay.
Just funny. I just had to tell that story because I think it is really important for our kids to be able to come to us and be able to talk to us about these things and not feel judged or shamed or whatever it is. Or I'm freaking out and be like, why are you asking me that question? Are you thinking about having sex or whatever it is? Because later on, if something is really serious down the line, whether it's in 2 years or they're in college or even as an adult, when things get really serious, you want them to be able to come to you and talk about these things. So I just wanted to tell that story. So come to lunch tomorrow, and then to end, Julia posted yesterday about today being Denim Day, which I've never heard of before.
Yeah. Okay, so I'm wearing a denim shirt. I'm wearing a wall of denim. I'm wearing denim jeans, a denim shirt.
Or dark denim.
Renee's wearing denim. So if you are wearing denim, if you are wearing denim in support of Denim Day or just because you're wearing denim, hashtag Denim Day.
So what is Denim Day?
I'm gonna tell you. So, but post a picture. It means a lot to the anti-violence community. But so Denim Day is an internationally recognized event in April in sexual assault month. It's always the 24th of the month. So I think it was, maybe 15, 20 years ago in Italy, there was a court case, a rape case in Italy. A rape conviction was overturned in one of the courts in Italy based on how tight the victim's jeans were. So somebody was convicted of rape, and the court threw out that conviction, overturned it, because the judge deemed that the jeans, the denim that the victim was wearing, were so tight that she must have aided in some way removing her jeans. And so that in and of itself implied consent, which is ridiculous, right? Because I'm wearing skinny jeans right now. They're not so tight. It's irrelevant, right? If somebody is hell-bent on doing something, anything, it could be really difficult to stop that person. So every time I talk about it, my heart starts to race because I feel so outraged. It's so ridiculous, and all of the different kinds of ridiculous messages that sends to people.
Well, you see it every day on Facebook whenever there's something that is posted about assault or rape, and you see the bazillions of comments going back and forth. And I've even had conversations with other women actually about this topic and gotten into kind of a heated discussion about it, because it's a lot of times it'll lead back to like, well, how was this person dressed?
Well, it's victim blaming.
Yeah, exactly. And and I think it's really, really important to know that it's not about the way that you're dressed, your daughter's dressed, or whatever it is. It's all about consent. It's all about the behavior on the other end. I mean, it shouldn't be about that.
Right.
It's really, it's upsetting.
Right. And I work with all kinds of people who have all sorts of feelings and give themselves really difficult times about all of the different things that they may have done or not done in the context of an abusive situation or an assault situation. Sometimes we do in the moment what we need to do to survive, right? We have no idea what was going on in that situation or how this person's pants came to be off, who facilitated what, and frankly, it really doesn't matter. So the concept, the thinking behind Denim Day, so Denim Day has been come to, this is kind of a day of reckoning. It's a celebration. It's, people do all kinds of, especially in the city, people do all kinds of really funky things with their denim as a way of showing support and raising awareness. So if you're wearing denim, like I said, hashtag Denim Day, post a picture. You have lots of really good support. I'm walking around in my great big wall of denim.
I've heard this.
She's wearing her denim.
I've never heard of this, ever.
There you go. Promoting awareness, right? So, but anyway, if you're interested in more information, if you're interested in knowing how other countries, other communities are recognizing Denim Day, you can click on the link that I posted yesterday. We can try to throw it up again today. And thank you for those of you who are wearing your denim in solidarity.
Yeah, I don't even know. I've never heard of it, so I wonder how many women. If you do know, if you already knew about this, oh, please like comment on it on this video. So we'll hopefully see you tomorrow. I know there's probably around 15 moms that have already committed, so it'll be great, guys. This is going to be a really informal, laid-back presentation. We're going to have lunch, and for any of those of you who come to our lunches, they're so chill. We have a great time. We talk openly. It's a safe space, and there's nothing to be scared about at all. And there's some great food. Great food. Great food. If you want to get out and have some great food. Thank you so much for being here. And if you ever, I just want to say this, I've said this all the time, but if you ever need anyone to speak to, bounce anything off of, need help with something in regards to disclosures and that sort of thing, because I mean I've had actually experienced a lot of that over the last several years, you can reach out to us always. I think you guys know after 4+ years of being in this community that this is a really safe space, and we have amazing resources within the community. So if you need to talk about something anonymously and you need support, always reach out. Yeah. All right. Thank you so much for being with us.
Yeah, thanks for coming.
All right. Happy Denim Day.
Bye, everyone.
Bye. See ya.